Good evening, everyone. Assalamu alaikum to everybody. We are very excited to have all of you join us. I am Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health here at Weill Cornell Medicine-Qatar. So we welcome you to the second session of our Population Health and Wellbeing series. The objectives are outlined on the slide, and these are also available on the website where you registered. So just some housekeeping. The session is being recorded. Your cameras and microphones are turned off. Please use the question and answer feature to type your questions or comments, and the questions will be addressed at the end of the session. As you all already know, this series is accredited both by ACCME and QCHP. Evaluation and certificates. So the post-activity evaluation will be available in your Cloud CME account by November the 21st. So you will receive an email notification once the evaluation is available in your Cloud CME account. And your certificates will be available for download once you complete the post-activity evaluation on the Cloud CME portal. So today's topic is really exciting. I think everybody will be really, looking forward to this session. So the title is Energizing Lifestyle Medicine in Challenging Times. And our speaker today is Dr. Ravinder Mamtani. So it's my honor and privilege to introduce Dr. Mamtani. He's a specialist in occupational and general preventive medicine, public health, integrative medicine, and lifestyle medicine. He is a professor of population health sciences, professor of medicine, and vice dean for student affairs, admissions, population health, and lifestyle medicine at Weill Cornell Medicine-Qatar. He's also an adjunct professor of community and family medicine at New York Medical College in Valhalla, New York. So prior to joining Cornell here in Qatar in 2007, Dr. Mamtani was a professor of clinical, community, and preventive medicine and associate professor of clinical medicine at New York Medical College, a physician in occupational medicine and also in complementary medicine at Westchester Medical Center in New York. He has several years of clinical experience utilizing lifestyle medicine to treat chronic diseases such as chronic pain, arthritis, mental health conditions, gastrointestinal problems, obesity, dyslipidemia, and diabetes. Dr. Mamtani has been an invited speaker on various topics in the US and internationally. He has published in prestigious peer-reviewed journals and also written a monthly column for a local newspaper in New York on contemporary health issues related to lifestyles and other topics. Dr. Mamtani serves or has served on many government, hospital, and medical school committees in the US and in Qatar. He is a diplomat of the American Board of Preventive Medicine in the specialties of preventive medicine and occupational medicine. He's also US board certified in lifestyle medicine and integrative medicine. So please join me in welcoming Dr. Mamtani. Dr. Mamtani, welcome.
Dr. Sohaila Chima, I appreciate that introduction. And good afternoon and salam alaikum to everyone. On behalf of Institute for Population Health and our entire team, I welcome you to this webinar. So here I am. I take it everyone can see this? Yes. So I'm really delighted to be here. As I said, it's a topic that I think has been receiving worldwide attention. To begin with, I have nothing to declare, no financial relationship. I will not be discussing any unlabeled or unapproved use of drugs or products in my discussion today. So these are the three objectives I hope to accomplish in the next 45 to 50 minutes. I will talk about the healthcare impediments in times of crisis, and I'll provide you with examples from COVID-19 pandemic, which is what we are experiencing at the present time. I will examine the evidence for lifestyle medicine interventions, and then go on to identify strategies that could strengthen the lifestyle medicine paradigm, especially when facing adversities such as the one we are in at the moment. This was a discussion by WHO last year in terms of the global health threats. This is before COVID-19 arrived, and they appraised the problems that we will see in the years ahead. Clearly, non-communicable diseases go at the top. We know that 70% of people worldwide are dying because of non-communicable diseases, such as heart cancer, diabetes, and so on and so forth. But here's the other point that they made, that 22% of people are in vulnerable settings as a result of conflicts, drought, famine, and so on and so forth. The third point that they make, we often don't pay attention to, is the whole global problem of air pollution. I was actually shocked to see a number of 7 million people dying because of air pollution worldwide. And then, of course, there was a discussion on communicable diseases, infectious diseases, how they continue to present threats to us. And put all together in healthcare systems that are weak to begin with in many countries, and affordability is simply not possible for many people. So before we go, I'd like to present to you two questions, and these are poll questions. My first question to you all is, if you were to think of where does the health come from, what would you say to the question, contribution of medical treatment to the overall health outcomes? What is it in terms of percentage? What percentage of total health that we see happens as a result of medical treatments? Is it 80%? Is it 60%? Is it 40%? Or is it 20% and less? Can you please respond to that question? We'll give you a few seconds. So again, based on your impression, what percentage would you say is attributable to medical treatments that we may receive from our doctors, healthcare centers, hospitals, and so on and so forth? Do we have a reasonable response, Raji? Can we? Okay. So we're seeing 80%, 60%, 40%, and 20. Okay. So we'll give you another second or two. And okay, I'm going to close the poll. So the answer is 80%, 60%. About 75% of you say, and maybe 90% actually say 40% and above. Okay, I'm going to close the poll. And this is what I would have said going back a few years ago. It's amazing how we develop perceptions, and obviously based on our readings, in terms of the contribution that the medical treatments make toward our health, overall health. And let me present to you, the correct answer is actually 20% or less. And this is something that was presented in New York about 2 years ago by Wayne Jonas, who worked at the NIH for many, many years. And he was able to quantify the role that different factors play in contributing to health. Look at this: behavior, lifestyles, social factors, and economic factors. And of course, they cannot be separated from some of the earlier ones, account for 84% of health. The health coming as a result of medical treatments is only about 16 to 20%. Okay, let's go to the next question. Is it possible to reverse heart disease? So we're talking about coronary atherosclerosis with lifestyle health approaches. When I say lifestyle, I'm referring to diet, physical inactivity, smoking, and so on and so forth. So I'm seeing a yes in a vast majority of cases, which is okay. I think we get the gist. And I think about 90% of you say yes, about 8% say no, and 1% say do not know. So the correct answer is yes. There is plenty of evidence that lifestyle approaches can reverse heart disease. There is also plenty of evidence to suggest that diabetes can also be reversed, and I'll talk about that in a couple of minutes. Um, so moving forward, we live in a world, and I want to establish the context for you of my discussion. Lifestyle crises and so on and so forth. We live in a world which is quite complex. There is an increasing population. The density is increasing. If you go to urban cities, there are more and more people. They're moving into the cities, jobs, and so on and so forth. We are traveling a lot more now than we ever did before. And of course, there are then global other problems: deforestation, change in habitat, global warming. There are issues surrounding social and political factors such as inequity, and they are widening, and I'll talk about that in a second. Social determinants, wars, local disturbances, unrest, and of course, more importantly, which is COVID-19 situation, is the shared environment and contact with animals. And here are two examples: avian flu, which presented a threat to us about 9, 10 years ago. I don't think it's quite behind us, but that's a topic for another day. And coronavirus. And what you see here are the pictures of two bats, which is where we think the coronavirus originated from. Obviously, all of these things, and if you read the ecology, the health, and so on and so forth, you will see that many of these factors contribute to emerging diseases: SARS, avian flu, the 4 pandemics in the past century, international crises, clearly tsunamis, radiations, displaced populations, and also the threat of chemical and biological threats from going back 20 years ago. So that world that we are living in, which is a complex world, provides a recipe, not completely, a recipe for emergencies, crises, and disasters. So let's begin with this definition of an emergency. Clearly, we said we're going to talk about difficult situations. Adversity, an emergency being the way it is, describes any public health event or incident presenting risk to life, health, and infrastructure, including natural, weather-related, and man-made destruction, infectious disease outbreaks, and exposure to biological, radiological, and chemical agents. So that's what an emergency is. People will say it's a broader term that includes crises and disasters. For the purpose of this discussion, if I'm using these words, I may end up using them interchangeably. This is what they do. This is what emergencies do, have done, and we know that. They cause death, they cause injuries, they create illnesses, they strain our healthcare systems. They're surrounded at the same time by confusion, misinformation, uncertainty. We've seen that with COVID-19. And press release statements which are open to interpretation. You read a story in newspaper, you might say, well, this is what I think the writer is saying, and I'll go, no, maybe not quite. Social and economic disruptions, jobs, inequities get widened. Risks are increasing and have become global. And especially when we see this world is connected in every possible way. And mind you, everyone is at risk, whether it's a direct risk or indirect. If somebody hasn't died because of COVID-19, there's no mortality, there may have been other social and economic disruptions, loss of job, loss of money, and so on and so forth. And that's what these emergencies do, as we have seen with COVID-19. So let's look at what has the past pandemics taught us. Here are the 4 famous pandemics that we saw: Spanish flu, Asian flu, Hong Kong, and swine. And this is what we have, COVID-19. Just stay with me. What you have here, if I were to convert all these deaths that actually occurred about 100 years ago and converted them to today's population of over 7 billion, the number of millions of a million people that would have died would be anywhere between 73 and 433 million people worldwide. That's what Spanish flu did to us. Look what Asian flu did to us in 57, 58, 2.7 to 10 million. Hong Kong flu, 2.2 to 8.8. And of course, swine flu, which also killed a lot of people, anywhere between 0.1 to 0.65 million. And of course, this number is much greater now. And this slide was made about 3 or 4 weeks ago and is increasing. So it's a comparison, but for you to know that from these 5 pandemics, we have learned the following. They have presented serious impediments to us, to the entire global community. They spread rapidly and they're difficult to stop. You may slow them down, you could mitigate, but stopping them is very difficult. Deaths are usually high depending upon the virulence of the organism. You may see an initial attack, then you may see a second and third wave. This is exactly what we are seeing with COVID-19. And they love socioeconomically disadvantaged situations. The health systems get overloaded. You remember the stories from the US not too long ago, 4 or 5 months ago. They were running out of beds, they were running out of ventilators. That's what they do. And social and economic disruption. I'll give you examples of what COVID-19 has done. But more importantly, fear and confusion. Sometimes the fear is legitimate, but if you combine that with rumors, which are hard to remove, it creates problems, serious problems. Now, if you take a step further and look at COVID-19 and look at what COVID-19 has done, I can tell you, and it has been shown, I'll show you some data, that COVID-19 has exposed cracks. Where we were weak, we would debate here and there. COVID-19 has widened those cracks so that we can see the challenges we are facing. And those have to do with our healthcare system. And clearly you will see that non-communicable diseases, I think I'm stuck here. Okay. We're seeing with healthcare, there is a strong relationship between COVID-19 and non-communicable diseases. The mental health problems are rising up, depression, anxiety, people are losing their jobs, and economy has been disrupted. There is no food for people. In fact, if you go to Africa, and I'll show you some numbers, the malnutrition they're saying will become widely prevalent in low-income nations as in African nations. There's been domestic abuse. Children are not going to school, and therefore that is suffering. The education programs have been hampered in primary schools, secondary schools, as well as in colleges and so on and so forth. And here's a summary of what COVID-19 has done specifically. They've hit us, they've hit low-income nations harder. Malnutrition will double, is what they say, in the next 6 to 9 months. Lack of healthcare, children are not receiving vaccines. All nations which have gone through lockdowns and distancing, people are postponing care. The hospitals actually are also don't welcome patients if it is for routine care. The screening and elective procedures are being postponed. The domestic abuse, depression, and suicides have gone up. And this is, in fact, a write-up from Journal of American Medical Association from July 1, 2020. And as I said, social and economic disruptions. And pertaining to lifestyle, people are now actually altering their lifestyles. There are reports of weight gain, lack of physical activity, and so on and so forth. So if you were to look at these, and in terms of the 5 or 6 competencies or components of lifestyle, the negative factors that we have seen based on research is in many communities, I think we are fortunate insofar as Qatar is concerned, this is not an issue, but if you look at communities elsewhere, non-availability of vegetables and fruits, people are relying on processed foods. There is closure of gyms and parks, limited time for physical activity, excess screen time as a result and stress. Sleep is being disturbed. There is stress, anxiety, and boredom, and people as a result are using more tobacco and other harmful substances. There are reports of domestic violence, family tensions, and women abuse. And of course, insofar as our social lives and bonding is concerned, there is loneliness and social isolation. And here's the data from WHO, which basically makes the point that hospitals around the world are not able to deliver care. There is disruption of services. And the higher in terms of the severity and the phases of illness you are in, the greater the disruption denoted by these red bars. And it's happening worldwide. So clearly, crises present effects which are direct effects, i.e., kill people directly or create illnesses. So COVID-19, as we know, is killing people and also creating prevalence of this COVID-19 disease. But equally important, I would say perhaps more important, its effect on other things, chronic disease, and I'll talk about that in a greater detail, delays in treatment, altered lifestyles, which is what I referred to earlier, mental health issues, social and economic disruption, and I mentioned some of these, but having an impact also on education. Think about children who are going to primary schools, who look forward to their initial educational experience, are being deprived of that experience now with COVID-19. We do not know what the long-term side effects are going to be. We will know maybe in a year or two, but clearly there is some indication that it may not look good. So those are the kinds of impediments that we have seen in the past and we are experiencing with COVID-19. So my discussion today is on lifestyles, right? And it's on lifestyles and which basically refers to, I'm often asked, what does lifestyle mean? Well, it refers to the usual way of doing things that we do on a day-to-day basis, right? We eat, so diet, physical activities, we sleep, we learn to manage and cope with stress. People engage in substance abuse, smoking, and relationships. So if you look at your activities that you performed, let's say yesterday, day before, this would be a summary of what we do, and we call these lifestyles. And that's where the whole lifestyle medicine approach comes in and its relationship to the crisis that we're experiencing. So for a minute or two, look at the way the world has done, or did at least up until recently. This is the life expectancy of nations around the world. Examples, you see Japan, South Korea, Germany, Qatar, all high-income nations doing quite well. And then, of course, then we have some middle-income nations and low-income nations. India being a middle-income nation, and then if you go down, you see others. So Qatar, like many other high-income nations, has done well. There are a couple of countries in this high-income group that stand out. Japan has a life expectancy of 84, and Norway is around 82. This is where Qatar stands today, quite good. I would say 79. We are 4 years distinct. Perhaps it's the recent, I don't know what the recent statistics are, but I'm sure it's upward nearing 80 and has done quite well, as I said earlier. And a lot has to do with the way Qatar has managed in terms of its primary care, public health, and medical care systems. Now, when you look at this life expectancy in high-income nations, this slide is a reminder that there are challenges we are facing and continue to face. And that includes even Japan, Singapore, some of the other nations that I mentioned, including Qatar. And here would be a couple of points to reflect the challenge. One is that people are still dying a little earlier than they should be, which is premature mortality. And we know that happens with heart disease, diabetes, and other conditions. And what is going to happen in the future? The obesity and diabetes rates are continuing to rise. This is the data from OECD nations, which are European countries. This is the prevalence of obesity. Look at this. This to me really threw me off the chair when I saw this slide data for the first time about 5 or 6 years ago. US, the rates, this is 230. The obesity rate is not stopping. England, Canada, Spain, France, Switzerland, all high income nations with solid primary care and hospital systems. But there is no sight based on the projections of this plateauing anywhere in the near future. That is worrisome. And the incidence of many of these conditions has been increasing. So where are the pointers? What is it that's happening which explains some of these perhaps high premature mortality rate or some of the projections that we might see in the years and decades ahead? And here are some very powerful, solid studies that have been performed in the world. All these studies, their names, you probably are familiar. I'm not going to go through each of them. Each one of them published in major peer-reviewed journals such as New England Journal of Medicine, JAMA, BMJ, and so on and so forth. They point to one thing, that these risk factors which are doing all this have to do with tobacco, unhealthy diet, physical inactivity, stress, alcohol, weight gain, and lipid problems such as hypercholesterolemia. And if you look at the data from high income nations, this is US, and if you were to look at other nations in Europe, it's comparable in terms of the risk factors. Same thing, diet, tobacco, weight gain, high blood pressure, physical inactivity, and so on and so forth. Here's the data from about 9-10 years ago for Qatar, and again, similar kind of a picture. You see a similar picture in these high income nations, which explain some of those increasing incidents and challenges that we encounter. I mean, people often say, well, okay, but give us a percentage. Well, here is a nice way to look at it. This is from the American College of Lifestyle Medicine. If I had to attribute a certain percentage of premature deaths in high income nations, 3 factors stand out: lack of physical activity, smoking, and unhealthy diet. Those alone explain 80% of premature or early deaths in high income nations. And needless to say that some of these mental health and other social relationships, and I'll talk about that, contribute to this, but are also responsible for other problems that do not get captured in mortality, but they cause pain and misery, depression, anxiety, and so on and so forth. So where does this fit in our world today? We began with that slide that you saw, the ecological model, where so many things are happening: deforestation, contact with animals, all of that, and people moving into urban areas, and then going through our healthcare system. And we said that people are dying prematurely because of diabetes, hypertension, heart disease, cancer. Now, even though depression and anxiety may not kill you, it may contribute, but that alone, if it doesn't kill you, it causes a lot of pain and misery and suffering. So this is what we talk about. When we talk about public health, we talk about the improvement, diabetes rates, hypertension, death rate going down, heart disease going down, up, and so on and so forth. Before these things happen, it is very important for us to know that human body, this is not the final outcome. This happens as a result of some of the changes that we begin to experience. Blood glucose level going up and down, cholesterol, high blood pressure, weight gain. Most people may not pay attention to weight gain. Well, I've only put on 10, 15 pounds or 25 pounds. But where is this going? If you go back and trace your history, in terms of what we have seen with mankind, you will see that some of these things are strongly related to, and I'll make that point in a couple of minutes: unhealthy diet, physical inactivity, smoking, stress, poor sleep, and poor relationships happening in an environment, in a certain environment, social, physical, and economic environment. That's the paradigm we are talking about. We're not just talking about diseases that are killing people. We are talking about a situation where this paradigm may be explained in simplistic language, such as bring in environment, combine that with poor or unhealthy lifestyles, and combine that a little bit with irresponsible behavior, and before you know, you have negative outcomes. And we think that this is being driven by underlying inflammation, that there are things that are happening in the body that is driving this and then leads people or to either develop diabetes, hypertension, heart disease, cancer, and so on and so forth. And our job is, as healthcare professionals, and the job of healthcare systems, academicians, and so on and so forth, is to put a block on this paradigm. The best way to do it would be right here, stop this, or somehow even try and reverse this, if you will. And that's our job, and that's a discussion that we are having today. And I was so glad to see the statement from 2010, US Healthy Report from Department of Health and Human Services, which made an excellent point. The government of the US, like many other nations, said, and this is a quote directly from the report, points out that the real killers are not heart disease, cancer, and so on, but rather environmental behavior and nutrition factors that I was alluding to earlier in that column 1, and with the environment sitting next to it. Cancer, hypertension, heart disease are outcomes, things having gone wrong, which is what is manifested when people or patients present you with symptoms. But the origin of that happens with the factors, the unhealthy behavior factors that you saw in column 1. Those are the real killers. Those are the real killers that are causing problem. Unfortunately, we do not capture those in death certificates. You know, you've been there. When you have certified someone dying because of a certain illness, the causes are cancer, hypertension, heart disease. We don't write these things. And that's why it took us so long to understand the contribution of lifestyle factors that is being made toward health, disease outcomes, and so on and so forth. We are convinced, we've been convinced for a while. I didn't know when I used to practice at New York Medical College and advising people on nutrition, physical activity, I thought I was doing simple, plain preventive medicine. A little did I realize that this is something that will become a specialty in its own right. It is a specialty today, and there are board examinations, and maybe if time permits, I'll talk about that. And this specialty, this focus rests on 6 pillars. And these 6 pillars are nutrition, healthful eating, physical activity, developing strategies to manage stress, forming and maintaining relationships. I would have never thought 10 years ago that relationships, the human bonding, our relationships with our loved ones, friends, you sit down with someone, have a cup of coffee, you talk with them for an hour, where you try and share stories or some of the disappointment you have in life, has an impact. It has a positive impact on the way you think about things, your health, and so on and so forth. Sleep, extremely important, and certainly avoiding risky substances such as tobacco and so on and so forth. These are the 6 pillars on which rests a new emerging field that I think is an inspiration trend in our healthcare system, the field of lifestyle health or lifestyle medicine. The evidence for LM or lifestyle medicine is strong, very strong. And you can go, here's a website, I'll show you some evidence in a couple of minutes, but this is where we stand. Heart disease, cancer, cognitive functions, diabetes, musculoskeletal health, mental health, general well-being, and even having an effect on telomeres, which tells you that the offsprings of people who are engaging in lifestyles by this mechanism, some of these benefits may be transferred over to children and their loved ones and their children and so on and so forth. That is how powerful lifestyle medicine is, and the evidence is becoming apparent and so strong. And I'll share with you some of the studies that have appeared in the peer-reviewed journals. This is, if you were to look at nutrition, just nutrition alone, portfolio diet, DASH diet, which was initially looking at the role of these nutritional products, and I'll talk about that in a second, for the treatment of hypertension, the Lion Diet Heart Study, the famous Mediterranean diet study performed in Europe, which confirmed that there is value to it in terms of prevention of heart disease, SLC plant-based diet for heart disease, and vegetarian diets, which have shown that people who subsist on vegetarian, predominantly vegetarian diets experience lower mortality rates and reduced risk of acquiring chronic conditions. Exercise. You know, I often say if exercise came in form of a pill, it'd be the hottest selling pill on this planet, honestly. And we know WHO, NIH have actually quantified the exercise that it contributes to good health and that physical inactivity in terms of causing to the major global burden of disease. It's quite substantial. Don't look at this as 6%. 6% converted into people or total burden of disease is humongous, okay, on heart disease, diabetes, and so on and so forth. We know, and the data is out there, that regular physical activity reduces all-cause mortality, cardiovascular problems, cancer-specific mortality in adults, and of course, improves muscle strength, mental health, and recent evidence to suggest that it also reduces the risk of acquiring or getting Alzheimer's disease. You know, we up until 9, 10 years ago, we would say that physical activity is great, you know, go exercise. What does that mean? Well, this is what it means. We've been able to quantify it. Now tell people that every adult should accumulate 30 minutes or more of moderate intensity level of activity, which is walking briskly, for example, on almost all days of the week, but at least 5 days a week. And if you were to convert that, that would be about 150 minutes per week. Or if you're intense in terms of your activity, that can go down to 75 minutes per week. The other important thing that we've learned based on research is that it's not as though you have to do all of those 30 minutes a day in one go. You can do this in short bouts. You can go for a walk in the morning, go to work, and during a lunch break, you can go for another 10-minute walk. And then at night, after your meal or in the evening, you can go for another. That all counts. It's cumulative. But here is something that appeared in British Medical Journal, which really has gotten the world very excited. And up until a year ago, this is what I thought, that you must engage in certain amount of physical activity, which is at a certain level in order to derive a health benefit. This amazing study basically said that is true to get an optimum benefit, but they went on to make a very, I mean, if you have time, read it, please. This is all recent, 2019. They basically made the point that all levels of activity, all intensities are associated with lower mortality in a dose response manner, which is what it was there before, that if you have a certain level of activity, 150 minutes per week, the effect is substantial, okay? That's the point. But to me, any activity is important and is encouraged. Plenty of evidence, beginning as early as 2010, that social relationships harness and bring about good health, positive disease outcomes, and reduce negativity, if you will, okay? And there is plenty of evidence to suggest that these relationships that I alluded to earlier lower the risk of mental and physical conditions and reduce overall mortality, both immediate and long-term. So harnessing healthy social relationships are always beneficial. And here's a study from Hart and 2016. See, all this is all recent. I can show you umpteen studies from 2019 making the point that in this case, it was loneliness and social isolation as risk factors for heart disease and stroke, and published in the famous journal Heart, documenting that. Now, those were all individual interventions. What is it when you bring them together? That's synergy. And that's where 1 + 1 becomes greater than 2. And here are just 3 or 4 powerful studies that make that point. Ornish's diet, his study that he published in JAMA, I have a slide on it in 1999, I believe. He threw people off the chair, I'm telling you. Basically documenting that you can reverse heart disease. People grappled with that in the beginning, but subsequent studies have confirmed that. There's been a famous CHIP study that has shown that diet, and I'll talk about that in a second, that if you have a plant-based diet, physically active, behavior change, goals, and so on and so forth, they can reduce the risk of these chronic conditions. A famous study published recently, remission of diabetes, remission of 46% at 12 months with a certain lifestyle medicine approach. And then also diabetes prevention, which basically documented, and here's the study, initially published in New England Journal of Medicine in 2002, and subsequently in JAMA and other journals. What they looked at was the role of diet and exercise as compared to metformin in pre-diabetics. And look at the results. The reduction was most in the diet and exercise group 3 years later. One of the criticism that healthcare practitioners will present to you in terms of lifestyle medicine is they would say, Ravi, I understand. But when you go look down the road, 10 years, 15 years down the road, that benefit disappears. Wrong. 15 years later, look at this, 31%. Mind you, that's substantial. For this diet and exercise to be able to achieve this lower reduction of diabetes at that level, to me, is quite big. And there's a lesson to be learned from that. This was a study that I was alluding to earlier that Dean Ornish published in JAMA, and it's a quote from the journal. I will read it to you. So they compared an experimental group, a group that was on vegetarian diet, aerobic exercise, stress management, smoking cessation, and psychosocial support. More regression of coronary atherosclerosis occurred after 5 years than after 1 year in the experimental group. And this was the experimental group. In contrast, in the control group, coronary atherosclerosis, i.e. heart disease, continued to progress, and more than twice as many cardiac events occurred in that group. This was an eye-opener. It was an eye-opener. And there have been other studies that basically are saying the same thing. So in the first 35 minutes, what we have seen is that crisis cause impediments, certainly having a major effect on chronic illnesses, and they're affected by lifestyles. In the second piece of discussion, I'm hoping that I was able to demonstrate to you that lifestyle medicine interventions can prevent and treat or reverse chronic illnesses such as heart disease, diabetes, and so on and so forth. And all of these contributing to good health as well from a prevention standpoint and for people to enjoy good quality of life. Now, and because of COVID-19, this is our third objective that I want to share information with you in the next 7 to 10 minutes, is what strategies can we use to mitigate chronic illnesses and improve health outcomes. So when I began to prepare some of these slides for that, I said, well, okay, what can we do? Well, I figured out we can do things at an individual level. We can do things at a community level. We can do things from our standpoint. What can Yale, Harvard, Cornell, or other schools do? What can hospitals do? And what can our government policies and other institutions do? So here's a listing of some of those, and with some of them, I'll share with you examples at an individual level who I feel should adopt a proactive role, awareness, self-care, exploring healthy lifestyle options. I know these are difficult times. I will show you data which basically says that we can be creative in exploring other options that make you healthy. And please, not to delay any essential care, especially when you're talking about cancer screening and so on and so forth. I know COVID-19 is an issue, but if you protect yourself, availing of services such as cancer screening is important. And please rely on information technology. I know how we Google information and come up with our own impressions, which in turn change and color our perceptions. This is a report from UK Department of Health in 2005, and another report from WHO basically said that patients who engage in self-care by way of participating in their own healthcare have better outcomes and higher level of satisfaction and fewer visits to healthcare providers. I'm not suggesting that you go triage on Google and make a diagnosis of your own condition that you might suffer. But what I'm saying is that ask questions, become a learner depending upon useful websites and so on and so forth. Empowering people. WHO in 2008 said empowering particularly women is important because women, educated women, are less likely to be oppressed and more likely to participate in programs clearly. And this is a case in point where health inequity is becoming a problem in times such as this one. And educated women who are aware, are likely to have healthier babies and families. So remember how I shared with you the negative factors? And our IPH team, our whole team, was able to debate in this discussion and look at references where we said, of course, we are running into problems. Of course, there are negative factors, but we also feel strongly that there are opportunities for us to engage in some behaviors that could be helpful to us. In this time, you can do more home-cooked food. Home-cooked meals are healthier than food from outside. You can find ways and means to become physically active. I walk up and down the stairs 6 times a day. I've done my 20, 30 minutes. It's an opportunity to perhaps find ways and means to regularize your sleep cycle. And smoking, it may be time to reflect. And there are people who, as a result of this, have been able to, they're in the family. Okay, you know, I should not be exposing my children to smoke. It's time to have a different way of looking at things. It's an opportunity to have more family time with your loved ones and things doing that you would normally not do, reaching out to neighbors, opportunity to engage in acts of kindness. So even in these difficult times, you can be creative and do things. Here is some points. We are all Googling, and I would urge you to pay attention to the sources of information that you see on different websites. Here are some pointers. If there are websites that make comments such as dire warnings, carbs are toxic, stop paying attention to those. We know carbs are not toxic. Recommendations which may be based on studies that do not appear in journals, peer-reviewed journals. There may have been studies conducted by someone who did something at home. Recommendations made from a single study, an observational study. Information that says, oh, this can cure this, or if you feel the claims are too good to be true, stay away from those. The websites that could be helpful are those that end with .gov, who.org, .edu, look at Harvard, Mayo, Cornell, NIH.gov. Look at authentic societies, APHA, American College of Lifestyle Medicine. If you're looking for information, those are the websites you want to go to. From a community standpoint, social connectedness, I alluded to earlier, while maintaining physical distance, bonding with neighbors. And here was something that appeared that caught my attention in the Journal of Public Health from as recent as May of 2020. A wonderful write-up on meta-analysis where they made the point that community lifestyle health proportion initiatives are producing fantastic results. And even for disadvantaged people. Now, this is wonderful because for low-income nations or middle-income nations where there may not be resources, people who go to let's say, a certain religious place, a mosque, if there are groups or support groups, you know, wonderful things to engage in lifestyle health discussions and finding someone who can come and talk to these groups. So immensely helpful. Academic systems, healthcare and hospitals can play an extremely important role. Strengthening education for students in lifestyle medicine, for healthcare practitioners, all healthcare practitioners, integrating lifestyle medicine and conventional practice to me is essential It is important. It's no longer an option for us to ignore that. Continuity of care and essential services, extremely important. And this is what to me becomes an attractive feature. Lifestyle medicine, the way it is practiced, and hopefully you'll have an opportunity to take some courses, lends itself to telehealth practice, which would be desirable in this day and age. The American College of Lifestyle Medicine is playing an extremely important role in furthering the goals of institutions and groups around the world in promoting lifestyle medicine programs. By the way, these are the approved CME programs by American College of Lifestyle Medicine. And for those of you who have an interest, please write to us. Ours is one of the programs that's approved by the American College of Lifestyle Medicine and the Board of Lifestyle Medicine. Right here, you see the listing that makes you eligible for the board examination. We've already offered two exams and 3 sets of certificate courses with wonderful success. And look at this. This was the result of our recent exam. This is the board examination in lifestyle medicine with an 85% passing rate. Policies, national societies can play a very important role creating communities conducive to good health. In countries where reimbursement is an issue, I think reimbursement would be something nice to have. And I would say to you, we are beginning to find out what we do with COVID-19 or chronic disease control. The basic principles are the same. Surveillance screening, building a strong, resilient society, equity, robust public health programs, and a clear communication. This was a write-up that appeared in The Lancet recently and pertaining to some of the lessons that they learned. They were talking about how we have a pandemic today. There may be another pandemic. There may be global warming, nuclear war, who knows what else. But what we've learned from the current and past pandemics is that political leaders must respect truth and defer to expertise, extremely important. The threats are global and require global cooperation and focus on collective survival that includes care for the least privileged societies, including those in low-income nations. Relying on the scientific truth is important. I talked about that, and communication is important. I want to spend a minute on this concept, a recent emerging concept, that while COVID-19 is important, and this is pertinent to this discussion, so are the chronic illnesses, right? People who have cancer, who have serious heart disease. And in fact, if you bring both those pandemics, if you will, or other pandemics together, we call that a syndemic. And there is a very strong correlation between this. And the syndemic approach is one where you have disease one, you have another disease, you bring them together, and the total disease burden becomes much greater than the disease burden associated with one of these diseases in terms of mortality, illness, and quality of life. Wonderful write-up in Lancet, in the Global Health of Lancet, October 17. You see, this is where we are now beginning to find out things, and people are writing about them. The term was introduced in the Lancet in 2017. And basically what they're saying is systemic approach invites a larger vision, one encompassing education, employment, all social factors, food and environment. Viewing COVID-19 only as a pandemic excludes such a broader but necessary prospectus. And what can I say? Public health has been neglected from times immemorial. A reminder from New York Times in April, after this thing happened, hit the world, COVID-19. They were talking about the US approach to public health. I think in this country, we are doing extremely well. Our hats off to the Department of Public Health, Ministry of Public Health for having done such a great job. But this is a US approach and written by Janine. Time to give new life to an old idea. A strong public health system is the best guarantor of good health. Communication is important. When you as a physician, you talk to your patients or to groups of people, speak in the language that people will understand. Be right. Present facts. Don't try and interpret too much. Present facts. Be credible. Tell the truth. Express empathy. Don't say, don't worry, but acknowledge the suffering and pain of people. Give people things to do. And I tell you, the stories are ample. The one thing that I feel, and this is what even the cdc.gov document says, is avoid using technical jargon. This should be avoid using technical jargon. There's a typo here, because that to me implies arrogance. You should speak to people in the language that they understand. So this is please don't use, that's what it is. It implies refute negative allegations. Don't repeat them. Don't assume you've made your point. When you've said something, don't make the assumption they've all understood. Go back and say, am I making myself clear? Avoid one-liners that have no meaning, and use cautiously in those situations. Addressing crisis challenges with lifestyle approaches at individual, community, healthcare, and policy levels has the potential to reduce chronic disease risk and premature mortality. Ignoring, to me, lifestyle, health, or medicine is not an option available to us anymore, folks. So with that, I conclude my discussion.
Thank you, Dr. Mamtani. Thank you to all our participants who attended the webinar today. So thank you, and inshallah, see you all next time at our next session.